Historically, there have been only a few studies that are focused in on MPN-AP BP when it comes to clinical trials. Oftentimes, trials that are meant for relapse refractory myeloid malignancies may also include MPN-AP BP. Many of our frontline AML studies specifically exclude these patients because the biology of disease is somewhat different. So in terms of kind of prospective efforts, we've had studies that have been reported out now looking at HMA plus Ruxolitinib in this disease, and it seems to offer response rates of around 40 to 50%, median overall survival of still less than a year. There are targeted therapy approaches that are being investigated prospectively. So the MPN Research Consortium has a study looking at JAK inhibition plus IDH2 inhibition in this disease for those that have an IDH2 mutation. Preliminary results were presented at ASH now a couple of years ago, and it was very encouraging. It was only 5 or 6 patients that had been treated, but the response rates were quite encouraging. So I'm very interested to see where that goes. And then there's a lot of preclinical work being done to identify targets that could then lead to prospective studies. So some targets that come to mind are LSD1, BCLXL, WEE1. Those are just some of them. There's several others. CDK9 is another. So lots of preclinical work that's offered rationale for how to target this disease. And now we need to translate that into prospective studies and see if we are able to definitively get a sense of is targeting a specific pathway outside of what we've typically done for these diseases the way to ultimately move the needle forward.